A number of the observations that were made in the early days of CV247 were largely anecdotal and were based very much on John's personal use of the combination in his own practice. But in order for this combination therapy to become universally used, it was necessary to conduct some formal clinical trials. These studies were undertaken in dogs and in cats, but mainly in dogs. There were 2 studies undertaken, which totaled in excess of 100 dogs with a variety of different types of cancer, from soft tumours to hard tumours and sarcomas. The objective was to ascertain whether or not there was an improvement in the quality of life. That was the fundamental objective. Even though CV247 does have some properties which would suggest it would act as a treatment for cancer per se, that is a very difficult endpoint to try and prove. But John's own practice was very much along the lines of finding something to improve the quality of life of the dogs in his care. And so these clinical trials that were conducted looked at that as the primary endpoint. As a secondary endpoint, if there was an observation made with regard to longevity, then that was commented on in the report. Both of these studies were undertaken by groups of veterinary surgeons in the United Kingdom, overseen by Professor Andor Sebastini, who was a veterinary expert, particularly with the treatment of cancer. The outcome of these studies, which were conducted over a period of some 2 years, was extremely positive. Not only was it found that in excess of 60% of the dogs did have a marked improvement in the quality of life using a relatively simple questionnaire which the owners were obliged to complete, which was graded in 10 segments from having no effect at all to a startling effect, including not only improvement, an obvious improvement in the quality of life, but also an improvement in the expected life expectancy of the animals concerned. This led us to extend those studies to try and ascertain what it was that CV247 was actually doing. As I've already said, it has known antioxidative properties. It is a known essential ingredient in enzymes such as the dismutases. But we wanted to see whether or not in using some in vivo studies we could learn more about its possible properties. And 2 studies were undertaken in which mice were used. One was introduced with a particularly virulent mouse lymphoma, and the other one, which was undertaken in rats, which was looking at introduced Lewis lung carcinoma. In both of these studies, it was learnt that CV247 did have an effect, particularly in the mouse lymphoma study, although in neither study did it demonstrate that it markedly improved longevity. But there was certainly a benefit which was derived as a consequence of the properties of CV247 itself. In order to try and learn a little bit more about the activity of CV247 itself, and particularly with regard to its antioxidative properties, they deliberately induced a highly oxidative effect in a series of rats using Cisplatin, a single high dose of Cisplatin. It was then observed that when CV247 was subsequently used, that a quite remarkable effect was seen, and that is that the nephrotoxicity commonly associated with Cisplatin was largely overcome by subsequent treatment with CV247. Now, this actually introduced a completely new benefit for the drug, whereas we felt quite confident that certainly in animal studies there was a distinct palliative benefit, and indeed following John's interest in the treatment of man, a number of doctors used CV247 on a compassionate user basis, and they also found that for some of their terminally ill patients, particularly those who were hospice-based, that there was indeed a benefit to be derived. Not in all subjects, but certainly in some. But the work at Semmelweis introduced a completely new concept, and that was whether or not CV247 could be used in combination with cisplatin, a drug which is highly cytotoxic and has a number of side effects which, if we could avoid, we'd be better off doing so. It's still a very commonly used drug, particularly for a number of solid tumours. The work was continued in Greece, again using the in vitro cell lines, but focusing exclusively on colon and breast cancers, and indeed discover that when used in combination with cisplatin, it had two very interesting effects. One, it seemed to allow for a lowering of the dose of cisplatin, which itself would very much reduce the side effect profile of the drug. But when cisplatin treatment was ceased and CV247 treatment was continued, it seemed to enhance the properties of cisplatin. If this can be shown in a clinical scenario, it would have a marked benefit for the treatment of certain cancers where cisplatin is the cytotoxic drug of choice.